Well, first of all, I would like as well to thank the organizers, Valérie and Nadej, for giving us the opportunity to present the M&E chapter of the book Strategizing Health in the 21st Century. I think it's an exciting opportunity for us. As well, listening to Nadej, I just heard that we are the last one. I have to say that normally this happens with M&E, with monitoring and evaluation. We are always the last ones. But I believe that it's not because we are the least, but only because it's so important that's why the organizers want us to be the last message that you are listening, you are hearing about the book. So as well, I would like to thank the coordinators of the book. I don't know if they are listening, but Gerard, Deepa, and Sonia for giving us the opportunity to contribute to this. This is not only my effort, but we are like 4 authors of the chapter. Tis Vorma, that he was the director of the department, Kavita Viswanathan, Kathy O'Neill, the unit coordinator, and myself. So I'm going to give the presentation on behalf of the team that wrote this chapter. I have about 20 slides, so I think it will take about 20 minutes. So please be free, as Nadej was saying, to write your questions, and we can have a discussion afterwards. So let me just start. So I would like to ask to start with a question. It's like, what do you think when you think about M&E? Maybe you can have a little reflection on this. And when I ask that, when I'm giving presentations or talking to people working at country level, what they think or where they talk, it's something similar to this. So let me just. So it's about, when they think about monitoring evaluations, suivi evaluation, what they think is about a frontline worker, a doctor or a nurse, filling reports, filling forms, filling registers. Meanwhile, they are not attending to the people that they are in need. And this is not completely inaccurate. So actually, I don't know if you are aware, we have conducted a research study on the time that people spend, like doctors and nurses in health facilities, the time that they spend filling forms and registers. We did that in 5 countries, 3 countries in Africa, 2 countries in Asia. And what we found is like between 20 to 40% of the time of a doctor or a nurse is spent filling forms and registers. So this is quite a lot, especially if we think that in this 40%. But however, M&E is not only this. Sorry, let me see. How can I move to the next slide? Yes. So it's much more than that. And when we thought in that image, we were thinking a little bit about the M&E maybe the last century, but not in the M&E of the 21st century. Now we have new information demands, but as well we have new technologies. We have to be able to respond to multiple demands from citizens, from communities, but as well from partners, donors, civil society organizations, etc. So just to start about the new information demands, as you are aware, most of the countries have signed the Sustainable Development Goals. We have 17 of them, and one goal is committed to health. It's SDG number 3. And this comes with a series of information needs. In the SDG 3, we are going to have 13 targets, 26 indicators that need to be reported. And if we look to the other indicators, that as well they have some health-related indicators in the other targets, like water, sanitation, food, etc. To respond to that, new guidance has been produced, like the chapter of this book, but as well other international guidance, like the 100 indicators, that I'm going to talk about that later. But just to give you an example, only in 2016, 18 countries of the WHO region of Afro were developing M&E plans of the national health strategies. So now, just to ensure that we are talking about the same when we talk about monitoring and evaluation. What I'm going to do now is like going step by step through the book and through the chapter, and we always start the chapter when we're talking about M&E like by the definition to ensure that we are talking about the same. Monitoring means bringing all data together to analyze progress of implementation of activities. Normally here we are talking about monitoring inputs and outputs and as well outcomes of the activities implemented. Evaluation builds on that, builds on the monitoring and looks whether if the results that we wanted of a particular national health strategic plan intervention were achieved or not. Reviews are slightly different. It's to look to all the evidence that has been gathered and is used to assess the overall progress and performance, to identify the problems, but as well to take corrective actions. So why M&E is so important, or why in any book related to health planning, budgeting, etc., is always like a chapter on M&E? Well, I think first of all, I think we can agree that we need to track progress and performance of the National Health Strategic Plan. As well, this country monitoring is going to be the basis for regional and global monitoring. A good example will be the reporting of the health-related SDGs and SDG 3. Before 2015, as you know, we were like globally and regionally and nationally tracking the MDGs, the Millennium Development Goals. But as well, it's not just that. As well is to monitor health inequities, how people have different access to services depending on their personal circumstances, like age, sex, or regional, or where they live. As well as we saw very recently with the Ebola outbreak and others, countries need a functional surveillance system to be able to diagnose, detect, and respond to notifiable diseases. And finally, M&E is important because of accountability. So our governments, ministries of health need to be accountable to their citizens, and this is the basis for a policy dialogue. And the information to do that, it comes from the M&E system. This is just to give you an example, and maybe you're familiar with this, about the SDG 3. I mean, the Sustainable Development Goal 3, that is the health related, that is ensure healthy lives and promote well-being for all at all ages. This goal of the SDGs this is the health goal, has 13 targets. And here you can see the 15 targets, and we can see that there is one target underpinning all of them. This is target 3.8, that it's about universal health coverage. So if you think about how was the monitor needs before the SDGs, when we're in the MDGs era, you can look to the column on your left, what we call here the MDG unfinished agenda. We're reporting basically in maternal and child health issues. However, now with the new agenda, we have new targets. For example, in the second column, we are talking about reducing mortality of non-communicable diseases, about promotion of mental health, as well about reducing deaths for traffic accidents. So a key question is, are our systems ready to monitor these new indicators that they are new into the agenda? Can we monitor the deaths from chemicals, from pollution, etc.? So as you can see here, just look into these 13 targets of the SDG 3, we'll see that the information needs have increased. So how we can address that in a systematic way? How we can ensure that we have a strong M&E system, or what we call an M&E platform? So here we have it. This is our conceptual framework to define what is an M&E platform from WHO. We can start from the bottom. So as any house, we need a solid foundation. And what is that when we talk about M&E? We need a solid policy. We need governance mechanisms, coordination mechanisms. And as well, we need an institutional environment that is going to allow to do M&E. On top of that, what we are going to see is the pillars of the M&E, and these pillars are the data sources. And here we are going to see the SNIS, what is like the Health Facility and Community Information Systems, the Système National d'Information de Santé, but as well l'enquête, the surveys, as well the census, as well the civil registration and vital statistics, the surveillance systems, the health systems monitoring, how we monitor like the resources that we have, human resources, financial resources, etc. And as well, of course, sources from other sectors, like the access to water, nutrition, etc. On top of that, it's not only to have data sources and to have the data, c'est pas seulement d'avoir les données, but as well we need to analyze this data. So what we need is strong institutional capacities for data collection, analysis, and use. And again, that's not enough. We can conduct a very good analysis, but if we don't take action, if we don't correct what is wrong, this is meaningless. This is not going to be useful. So finally, what we need in the M&E platform or a good M&E system is effective country mechanisms for review and action. And obviously, all of this needs to be linked with the national health policies, strategies, and plan. We are not monitoring in a vacuum. We are not monitoring because of the sake of monitoring. We want to monitor what it is, what are the national and international health priorities. So in the chapter, what I'm going to do now is to go through all the 4 components of the M&E platform, starting by the bottom, by the sound policy, governance, and institutional environment. In the chapter, you will see that there is a description, what it means, and as well there are suggestions to improve them. So when we talk about a sound policy, governance, and institutional environment, we are talking about having coordination mechanisms, about having a robust, a good, solid M&E plan. This plan needs a framework with indicators, with targets, with means of verification, etc. And these indicators need to be agreed at national level, not only the SNIS unit, the Health Information System unit, but as well the different programs. And as well, we need to have a common investment framework. What is a common investment framework? It's like when you identify the priorities that you need to strengthen your M&E system, you need to decide and to discuss who is going to do what. And this is especially relevant in the countries that they have many partners in place. So how we can avoid like partners that are implementing different M&E systems. So now I will give you a couple of examples that as well you can find them in the chapter. One is Kenya. In Kenya, they have like a very fragmented system. So what Kenya did, it was like jointly with partners, they defined the M&E priorities that they had at country level. That they were on data analysis, on quality of care performance, like being able to display and to share the data with the citizens, that was the Kenya Health Observatory, civil registration and vital statistics, and as well to conduct a midterm review of the National Health Strategic Plan. So the country, the Ministry of Health, convened all partners, and jointly they developed a plan that they call it the Kenya Health Data Collaborative Roadmap. And here we have a quote from the Principal Secretary of the Kenya Ministry of Health. We now expect all health data collaborative partners to pull in the same direction. This roadmap of this plan was useful to avoid fragmentations of the M&E system, to define the priorities, and then to, in a later stage to implement them. So here what we are seeing is like we have a very solid, a very good foundation. Here we have as well another example, as well as in the book, and it's about this document that it's in French and as well in English. It's available in the WHO website, and it's the global reference list of 100 core health indicators. This is a standard set of 100 indicators that they have been prioritized by the global community, but as well with countries, to provide key information on the health situation and trends of countries. Just to be clear, these indicators are not mandatory for countries. It's just a reference. But countries, some countries like, for example, DRC, la République Démocratique du Congo, and other countries, they are using this list to reduce the number of indicators that they have at country level and to rationalize the needs of information that they have. The second component of a good M&E system are the data sources, the well-functioning data sources. And I think we already listed them. But how we can make them more functional, how we can ensure that the SNIS is working, that we have a good surveillance system, that we have like this, the right surveys in place. So as well here in the chapter, here you can find some examples of priority actions to strengthen this. For example, to define the standards, as well to have a data architecture. So how we can ensure that the different subsystems, they talk to each other. One of the problems that maybe you're aware is like in any country, we'll have a routing system for most of the data coming from facilities, but then we'll have different parallel systems for immunizations, for vaccines. Some countries, they have their own system for HIV, for paludism, for TB. So how we can ensure that these systems are integrated. As well, the other problem that a lot of countries they face is that they have a lot of surveys. Each partner or each donor, they implement their own surveys. So here in the chapter, or here what we are suggesting is like the country needs a survey plan, that the country knows when the surveys are going to be implemented, and the surveys actually provide the indicators that they are needed to monitor the national health strategy. And as well, I'm giving you an example. You don't need to read this, but this is just to show you the 26 indicators that we have in SDG 3. And if you look to you have in the left, gauche, vous avez les indicateurs, and in the right columns, you have the preferred data source, which is the preferred data source for each indicator. And as you can see, there is not a single data source that it can provide all the information needed to monitor the SDG 3. And as I said at the beginning, this is just the 26 to monitor SDG 3, but we have as well about 10, 12 other health-related indicators in other goals. So in summary, this highlights the need of strengthen all the data sources that you have at country level. Now I'm going to talk about the third component, that is strong institutional capacities for data collection, analysis, and use. As well here, we need to think like the capacities are needed in all the different stages, from data collection to data compilation and storage, data quality assessment and validation, data analysis and performance, estimation and modeling, and as well dissemination of the information. And as well, in my experience, this is one of the components of the platform that normally needs more work or more support. And here in the book, we list some priority actions like conducting analysis and use workshops, to produce performance reviews and analytics reviews, to publish the information in an accessible way, in a way that can be easily understood by the population, by decision makers, by practitioners, etc. And as well now some countries like Kenya or Rwanda in the African region, but as well Bangladesh and others, they are establishing national health observatories where any person can access to the data that they need or they want to check. here as well is an example that we have in the chapter is about the importance of displaying data. And here we have like an analysis of some key indicators in Kenya based on the demographic health survey conducted in 2007 that it shows the inequities. So if you look, for example, to, I don't know if you can see it properly, but if you look to the first indicator, demand for family planning, you will see that the difference between the richest and the poorest is quite significant. Like the richest 20% of the population have almost 100% the demand for family planning satisfied, but for those in the poorest quintile, it's less than 50%. And you can see, like in some indicators, that difference, the gap is quite huge, it's quite big. In other indicators, like for example, ANC1 visits, the difference is very small. What we are seeing, like in Kenya, according to the DHIS 2027, even rich or poor people, they have women, they have access to ANC1. But there are like some indicators or some interventions, like family planning, like DTP3, vaccination against DTP3, etc., that there is a huge gap. So how we present the data, how we communicate the data is key. So it's key to inform decisions. And this is the fourth component of a well-functioning M&E platform, that is having country mechanisms for review and action. It's not just about having the data, it's as well about taking corrective action and to improve it. And again, here we describe the key attributes. That the most important one is to have a system of regular reviews of progress and performance of the National Health Strategy. But as well, sometimes you need independent reviews. It's not just the Ministry of Health looking to the data, but you would like to have research institutions, academia, involved in conducting reviews, independent reviews. And as well, civil society organizations need to be involved. Finally, the results from the reviews need to be incorporated into the decision-making process. And as well here, we have an example that this is as well from Kenya. I mean, I think we have like few examples from Kenya. But this is as well the conceptual framework about how a performance review is conducted. In one side, and this is the first side circle, you will have the analysis of health data. Below as well, you need to conduct the analysis of the activities implemented and as well the budget. And when you put these two analyses together, always in an inclusive and participatory way, then you can have a policy dialogue about what happened, why the strategies have worked or not. So this is, I think, like the key component and the ultimate goal of the M&E. It's not only about having a good governance, very well-functioning data sources, and having analysis of data. It's to link all of this with the decision-making process. Finally, in the book or in the chapter, we go like through like the who, the when, etc. So who should be involved in M&E? So I think we talk about that during the presentation a little bit. This is not just a Ministry of Health business. This is as well other government institutions. As we know now, health is not just under the Ministry of Health, but it's something multi-sectorial. We need the Ministry of Education. We need the institution dealing with nutrition, etc. As well, the National Public Health Institute need to be involved. The partners in country, global partners, etc. The civil society organizations, and as well the national research institutions. All of them, they can have different roles in the M&E. And finally, the when we conduct M&E. As you know, monitoring is a continuous process. But here in this slide, what you can see is like how the different sources, they contribute to the country planning and review processes. So as well, if you start on the bottom of the slide, what you will see is like there is something that should be continuous. This is the registration of vital events, of births and deaths. So, and normally if a country has a good civil registration and vital statistic systems, this will be done in a continuous way. On top of that, we'll see the household surveys. This cannot happen every year because they're expensive and they are like very resource consuming. So the current thinking is like that countries can have household surveys every 2 or 3 years to monitor specific indicators of the national health strategy. On top of that, we have the facility assessments. And perhaps you are very familiar with SARA, but as well there are other facility assessments. That it means like going to a facility and to conduct an independent review about the service availability and readiness of services. And on top of that, we'll have the normal routine information system. So all of these data sources, in annual basis, they should contribute to the annual health sector progress and performance review. And as well, if typically national health strategies are 5 years, so in year 3, we'll have the midterm review that is more comprehensive, and in year 5, we'll have the final review that they will help to inform the next strategy. So I'm moving now to my next slide. I think, as I said, it's more or less like 20 minutes that it took. So, and to me, this is the key slide. I mean, this is maybe the key message that I think it's useful for you to take away. So how we can strengthen the M&E system, the country-led M&E platform. So here are like 5 easy steps, and please just remind them when you need to. If you are working in M&E or in planning in a Ministry of Health, or you want to, so please remind these 5 key steps. The first one is to assess the key attributes of the M&E system. What do you need? So how it looks like an M&E system. And for that, you have this guidance, you have the chapter, but as well you have more guidance from WHO. Maybe as well you are familiar with the Monitoring, Evaluation and Review of National Health Strategies book, what we call it the Blue Book. Suivi, Evaluación y Revisión de Estrategia Nacional, that was published in 2011. So first of all is to conduct an assessment of your M&E system and identify your priority actions, what you can do to improve them. The second step is to review your indicators. As well, in our experience, what we are seeing that most of the countries, they have a lot of indicators, and as well the different programs like HIV, TB, malaria, maternal health, they have their own indicators. So in Malawi, for example, when I was in Malawi last year, we found that just for the HIV, there were more than 1,000 indicators collected in routine basis every month from health facilities. So remember, the second step is to rationalize, to review and to select a core set of indicators and develop the baseline and the targets to monitor the national priorities. The third step, it will be to develop a plan, to develop an M&E plan. So in the plan, you will need to identify who is going to do what, the roles, the responsibilities, the M&E framework, how you're going to strengthen your data sources, etc. And the plan should respond to the needs of the national health strategy, and as well should be aligned with the disease-specific plans. But this, as you well know, is not enough having a plan, but the plan, if we want the plan to be implemented, we need the resources to do that. So the plan needs to be costed, and as well a common investment framework needs to be developed as the basis for domestic and partner investments. If we know what we want to do, we're able to cost it, then we'll be able to decide who is going to pay for what. And finally, the last, but again not least step, is to review and evaluate how your M&E system is going. As anything, I mean, it's the same. You are reviewing and evaluating the National Health Strategy. You need to do the same with the M&E platform. And I think that's it.